Hi, faculty, family, friends, fellow students. We are honored to be wrapping up the DSI Thesis Show 2018. We are so close, 10 minutes away.
Yes, yeah. So we will keep you for 10 minutes only. But before we celebrate, we have one last story for you. Before we came to DSI,
I was designing public services.
And I was working in global health. We wanted to use this thesis project to bring design to people who didn't have access to it. And so, going with the most extreme option, we reached out to two doctors who work in different jails to see if we could be of use. And we asked them, "Do you have any problems?" And they said they had us covered. What kinds of problems were they talking about?
People inside jails often really are sick, mostly because of social conditions such as racism and poverty. In this era of mass incarceration, these are also the reasons they are arrested and brought to jails. They arrive with high rates of chronic disease, like diabetes, tuberculosis, mental illness, and hepatitis C. So jails actually serve as a public health safety net for millions of people. 80% of them have not received care before coming to jails. So for providers who work in jails, this means that they have a big job. The question was, could design help?
So the first step was just getting clearance to get inside the jails. Our criminal background checks took 6 times to get our fingerprints approved in 3 months. And they finally gave us our badges, so we have all of our supplies ready to go. We've been waiting for this. We head to the jail, we get to it, we get inside the door, and we're met by the correctional officers at the security check, who explained to us that we may not bring in all those supplies. Instead, a notebook, a pencil, and our badges, and our eyes and ears would have to be enough. And so, long bus rides that start at 3 a.m. Become our lives as we go into the jails to meet people that society wants to forget about.
But not everyone wants to forget. We found nurses, doctors, pharmacists, technicians, and counselors taking care of people when they brought to jail, when they come back for their appointments, and for emergency treatment. The spaces also had correctional officers to maintain safety, and we started to ask questions. What were their best and worst days like? Why did they decide to work there for 15 years? It was an intense environment, and they were so dedicated to do their work. And they were also glad we asked. With an understanding of what correctional health service could provide, we went back to the doctors who we first contacted and presented our insights and told them what we heard and saw.
And we presented them as opportunities for change, things that we could address with this project, like how siloed departments hindered collaboration, and how shifting schedules for patient appointments, the patients found them really confusing. And we also noticed how the spatial design of the clinics created conditions that seemed to interfere with the healthcare services. Together, we realized that there was something different about spatial design. It impacted everything, from patient experience to values to communication. We'd found our thesis topic. How might new spatial designs in jail clinics create conditions that better meet people's needs?
And we went back to the jails, now to explore every cranny of the clinics, not just one, but a few, to make sure that the challenges we saw were common. With maps in hand, we did interviews, we located the challenges, and then drew them out.
I'm on edge when I come down to the clinic. I always have to watch my back in here. It's so hard to focus.
Just things like orientation of the chairs in the cubicle expose patients to busy hallways.
I do my best to mind my own business, but you're trapped in this cage, and sometimes you have to fight just to protect yourself.
Pens that are used for safety are actually causing stress and sometimes violence.
We try to provide them with supplies, but the alarms are always going off, and we get stuck here.
The jail security alarms cause lockdowns, and when no one can move, things like medication delivery get delayed.
But could new designs meet their needs? Staff used paper prototypes to explore ideas.
If my office had something for privacy, my patient could feel so much safer.
In order for patients to benefit from the therapy services in the jails, they need to feel safe in the conversations.
If the waiting rooms could be outside the hectic clinic and just gave something to do, it would be totally different.
Now the waiting rooms are inside and they only have metal benches in them, so it's easy for tensions to arise between the patients and the staff.
It would be amazing if our departments were this close. We wouldn't have to work so hard to coordinate our services.
Many services see the same patients, but without a chance to synchronize, the schedules are so complicated that it's really difficult for the patients to follow them.
So there were so many ideas about the new clinic design, and it was time for us to start drawing on a solution. So story after story, themes started to emerge. From our prototypes, we could see a pattern of what fulfilled needs actually looked like. So we have 2 deliverables for a thesis project. First, a set of principles to guide the spatial design of a new health clinic.
So, refuge. Patients need to feel safe to focus on healthcare.
Dignity. Patients need to feel respected to not communicate with violence.
Simplicity. Patients need to experience care alignment to fully access services.
Connection. Staff need to have opportunities to collaborate built into the workflow. For patients to feel safe, things like partially frosted plexiglass form privacy walls for every patient area where they're seen. And this way, the patients can feel safe and the clinics can still have oversight. Small waiting rooms outside the clinic are libraries and living rooms, treating patients like people instead of liabilities. If you're treated with respect, you don't need to use violence to communicate your needs.
What happened? Simplicity. When patients have multiple appointments, the clinics are now in a cluster, a one-stop shop, and it makes it so much easier for the patients to get to all their appointments.
And staff conference rooms and break rooms are shared and centralized, creating natural opportunities for conversations and meetings. The healthcare becomes more efficient and the teams becomes more effective.
So, this clinic design is just a start. It doesn't represent all the ideas that we heard, and it doesn't meet every need that we heard either. But as one provider said, now that could actually work. Could it work? Where does our work fit in the world today? We're not the only one looking at jail design. Because of mass incarceration and the dire need for criminal justice reform, governments, agencies, and private firms are brainstorming new jails. We think our work offers 2 missing pieces, though, things that are vital. First, everyone agrees that these should be spaces of rehabilitation. We learned that for many people, rehabilitation means getting access to medical and mental health support. Yet, these proposals don't often emphasize, or let alone mention, healthcare spaces. We think this is potentially quite dangerous for the people who would be most impacted by the new facilities, the patients and the providers.
So second, and maybe not unrelated, the proposals seem disconnected from reality, because they do not talk about what people inside jails actually need. So are the problems understood? Like most social problems, the people who are closest to them have the most knowledge about the problems, but the least power to solve them.
With emphasis on healthcare spaces and by leveraging essential expertise, we think our work is cutting edge and crucial to the future, not because it has the latest technology or the most refined plans, but because it is led by the people who have the best understanding of the problems we're all trying to solve. So, what do they need to solve them?
Just ask.
That's